Bismillahirrahmanirrahim and Assalamu alaikum. Today I am giving the presentation on the case study of acoustic neuroma. Mahmood, a 55-year-old technician, works in a cargo section at the airport. He presents to a local general practitioner because of progressive decrease in his hearing for the last 5 months. Recently, he noticed that he has become unsteady and feels that the surroundings are rotating. He also has noticed numbness on the right side of his face. Discussion questions. Are there any difficult words where you do not understand? List the key information about Mahmood. Identify Mahmood's presenting problem. From each problem, generate a list of possible causes, hypothesis. What further information would you like to know from history to refine your hypothesis? Key information: 55-year-old male technician. Presenting problems and hypothesis: decreased hearing, earwax, otitis media, perforated eardrum, that is tympanic membrane. It might be problems with the inner ear or the eighth cranial nerve, problems with the hearing center. The causes of unsteady surroundings or rotation might be due to problems with the proprioceptor, sensory nerve, dorsal column, cerebellum, problem with the inner ear, problem with the eighth cranial nerve, postural hypotension, decreased blood flow to the brain, and autonomic dysfunction. Presenting problems: numbness on the right side of the face, problem with the sensory receptor in the skin, problem with the sensory nerve, problem with the nuclei of the sensory nerve, problem in the higher center in the cortex. What structure and function do we need to hear? External ear, middle ear, a healthy intact tympanic membrane, malleus, incus and stapes, inner ear, cochlea, organs of corti, auditory nerve, hearing center. What structures and functions do we need to feel steady for balance of the body? Normal proprioception, healthy peripheral nerve, normal dorsal column, normal cerebellum, normal vestibular system, normal semicircular canal, vestibular receptor cells, vestibular health cells, normal vestibular nuclei, normal vestibular spinal tract, no postural drop of blood pressure, normal blood flow to the brain. Questions to be asked in history. Do you remember any history of ear trauma? Do you have any fever, discharge or ear pain? Do you feel any noise in your ear? For how long do you have this sense of rotation? For how long do you have this sense of rotation? That is, do you feel sense of rotation when you change your position, that is from sitting to standing, for example? Did you have any nausea, vomiting? Are you on medication? Do you have any runny nose or sore throat? Have you been admitted to the hospital? Are you diabetic or have you any other medical conditions? For how long did you feel the numbness on your face? Do you have numbness elsewhere else? Mahmood first noticed that when he uses his mobile phone, he hears better on his left ear. About 2 months ago, he was recommended ear wash because of excessive wax. This did not improve hearing on the right side. There is no history of trauma to his ear or chronic ear problem. A few weeks ago, he started to hear ringing noises in his right ear. About 2 to 3 months ago, he noticed that the surroundings are rotating. He particularly feels the surroundings are tilting when he changes the position of his head. This caused a lot of anxiety and worries because of the nature of his job. It is progressively increasing in frequency. First, it occurred about once or twice a day, but the last few days it occurs 6 to 7 times a day. 3 weeks ago, he noticed numbness of the right side of his face, particularly while shaving. He gives no history of numbness or tingling elsewhere. He did not have any history of fever, ear discharge, pain or runny nose. He is always fit and never hospitalized, and his regular checkup are always normal. Smoking and alcohol is nil. Medication allergy nil. Family history: he has 4 sisters and brothers. All are fine. He is married and has 2 children. He is working at airport for over 12 years. He is always fit and healthy. He likes his work. Summarize key information that you have obtained from this progress. Identify Muhammad's new problem. Provide hypothesis for each problem. What further information would you like to know about conducting a clinical examination? Decrease hearing, right ear, ringing noise, right ear, sense of rotation of surrounding, anxiety, worried, numbness, right side of his face. Facilitation questions: what are the mechanisms by which we hear? What are the mechanisms by which the body maintains its balance? Which cranial nerves are involved in this case? Clinical examination reveals blood pressure is 120 by 85 millimeter of mercury, pulse is 82 times per minute, respiratory rate is 19 times per minute, temperature is 37 degrees centigrade. Ear examination: external ear normal on inspection or no earbags, no tympanic membrane is healthy, normal, healthy on both the sides. CNS examination: gait is normal, cranial nerves number, student, that is the olfactory number 1 nerve is 1, 2 is optic nerve, third is oculomotor nerve, fourth is trochlear nerve, sixth is abducens nerve, and all are normal. Fifth, cranial nerve, trigeminal nerve, loss of corneal reflex on the right side and loss of sensation on the skin over the right maxilla, normal on the left side. Clinical examination: the seventh cranial nerve, facial nerve, weakness on the right side of the face, normal on the left side. The eighth cranial nerve, vestibulocochlear nerve, evidence of sensory neuronal hearing loss on the right ear, normal on the left ear. Other cranial nerves: glossopharyngeal nerve, 10th vagus nerve, 11th accessory nerve, hypoglossal nerve is 12, all are normal. The motor and sensory systems are normal on both sides. Coordination tests are normal, excluding the cerebellar problems. Cardiovascular and respiratory examinations are normal. Progress 1. Because Mahmood has unilateral hearing loss, vertigo, unsteadiness, numbness on the face, facial weakness, it is most likely that these changes are due to the problem affecting the 8th cranial nerve as well as the 5th and 7th cranial nerves on the right side. The doctor arranged for audiometry and MRI brain. Audiometry of the right ear. There is evidence of high frequency of sensory neuronal hearing loss. Lower curve bone conduction is relatively normal. Upper curve, these changes are consisting with the possible diagnosis of acoustic neuroma on the right side. Left ear is normal. MRI scan with gadolinium of the brain coronal showing an acoustic neuroma on the right side of the brain with the white spot on the left side of the picture. Progress 2. Mahmood is referred to a neurosurgeon for further assessment. The neurosurgeon examines him and after reviewing audiometry report and MRI brain scan, says that the investigation showed that he has a small tumor on the 8th cranial nerve on the right side. He explains that this nerve is responsible for hearing and it help in maintaining the body balance. Usually such tumors are benign. The symptoms are due to the presence of the tumor on the nerves located close to the 8th cranial nerve on the right side, such as the nerve that carries sensation from the face, the 5th cranial nerve, and the nerve that carries motor impulses to the muscles of the face, the 7th cranial nerve. The neurosurgeon advised Mahmood stereostatic radiation therapy to stop the growth of the tumor and relieve him from his symptoms. Learning outcomes: discuss the function of 5th, 7th, and 8th cranial nerves. What is the mechanism for maintaining the body balance, and what are the mechanisms responsible for hearing? Thank you. That was all about the acoustic neuroma.